After my first application, my dad inquired about making an app together. He wanted to answer the most common question he gets asked: what's my risk of heart disease? Using his knowledge and some cardiac research, I developed an app that could do just that, using only a few pieces of information. Now let's say I'm a man who's 38 years old. I just enter my age and move on. Now I have to enter my HDL cholesterol, but if I forget, it reminds me. Let's say I have an HDL cholesterol of 45 and a total cholesterol of 82. I can also switch to the European standard of measuring cholesterol if I'm not in the United States. Next, I have to enter in my systolic blood pressure. However, I realized I made a mistake when putting down my total cholesterol. It should be 85, so I just go back and change it. I return to record a blood pressure of 120 and move on to 3 simple questions. Let's say I don't smoke, I'm not diabetic, but I am on blood pressure medication. Next, I move on to other factors that my dad helped me pick out. Everything from family history and lifestyle to diet and alcohol consumption can alter your risk, so I decided to include these to make the results more accurate. Finally, you are presented with an overview to make sure all the information you entered is correct. If it is, the application presents you with your percent risk of heart disease in the next 10 years. This person was relatively healthy. But the application also provides individual tips to lower that risk even further. For example, this person had a low HDL cholesterol, something he should probably work on. Pressing the info button will take you to the screen that describes exactly how this application was made. It uses the results from the ongoing Framingham study, which has compiled research for over 50 years from patients worldwide. I also mentioned that I used my dad's personal knowledge for the factors mentioned earlier, as well as the consultations on the results page. This app has helped thousands of people keep track of their risk and lead healthier lives.